Well, this is Breast Cancer Awareness Month. It's a disease that, of course, we talk about primarily as impacting women, but most of you may not realize that it's only primarily impacting women. Men can be affected as well. And this morning, I'm happy to talk to a man who fought hard and survived breast cancer. His name is Bob DeVito. Joining me this morning, a pleasure to have you.
Thank you so much for having me.
Well, thank you so much for taking the time to come on and talk about something that personal illnesses are not always easy for people to talk about, much less on camera.
And I'm passionate about it.
Yeah.
Yeah.
So that's good that we get you on here. Well, why don't we just start by telling us your story. When were you diagnosed, and what were those moments like for you, Bob?
Well, I was diagnosed in May of 2012.
Yep.
I was diagnosed with stage 3A invasive ductal carcinoma.
Oh, wow.
Years earlier, I had a little pea-sized lump just about the 12 o'clock position above my nipple.
Yeah.
And mentioned it to my family doctor, and he wasn't overly concerned. He said, well, it's probably just a cyst, we'll watch it.
Okay.
And fast forward a couple of years, the lump grew bigger. I was in for actually an ear infection, and I just happened to mention, gee, doc, what about that lump I felt?
Right.
Let's take a look. And so I'm in this small exam room with two student doctors and a student nurse. And they're all trying to irrigate my ear and getting me all wet. And I just happened to remember and say, what about that lump?
Yeah.
Said, let's take a look. The shirt comes off. He mumbled something to the medical students about that I had an inverted nipple, which is one of the signs.
Okay.
And so he scheduled a mammogram and an ultrasound.
Right.
I went to see a surgeon locally and asked for a second opinion, and found a doctor, Dr. Beth Sealing out of Southbury, who actually was my second opinion. I chose to use her for my surgery. Okay. And that really is it. You know, it's been a wild ride for four and a half years.
I can imagine, and it's led you to where you are today. We do have a picture we want to pop up here. This is, when was this taken?
This was taken about 3 years ago.
Right.
By a photographer named David J. He has a website called The Scar Project.
Okay.
Where he has women with mastectomy scars. He also has an offshoot of that of combat vets that have, are amputees and such.
Yeah.
So he decided that he was going to do a piece on male breast cancer. And
yeah, because it really is the same thing. It looks like a mastectomy, and you've got your scars from it.
Yeah.
If we're going to try to save some lives here, a lot of guys, you're starting from square one with guys. I'm sure a lot of them out there don't even realize that male breast cancer is a thing.
Exactly.
What are the signs that they should be looking for, though?
Well, they should be looking for any kind of change to their chest or underarms.
Yep.
In my case, I had maybe a ping pong ball sized lymph node that had blown up under my arm, and I noticed it while showering.
Yeah.
Didn't know what it was, of course, thought the worst, which led me to I was seeing my doctor anyway the next 2 weeks, so I just waited. They also could have nipple discharge, some puckering of the nipple inversion.
There will be something, and it's more or less centered often very much around the nipple.
All the breast tissue is very
Yeah.
close to the nipple.
Yeah.
That's why they can't do nipple sparing surgery for male breast cancer.
Yeah, it has to go to get it all out there.
Yes.
So what about, did you undergo chemotherapy, radiation, anything?
I went under 6 rounds of chemotherapy.
6 rounds.
And 25 daily doses of radiation.
Yeah.
And then after that, I was put on a 10-year regimen of tamoxifen, which is an anti-estrogen hormonal, drug. Helps suppress the estrogen and hopefully keeps me in the clear. And I get the typical reaction to it, hot flashes, sweating, and all the things that women go through. We're so pigeonholed into that because there's so few of us.
Yeah.
This year, the American Cancer Society says that about 2,600 men will be diagnosed in 2016 with male breast cancer.
Okay.
And about 440 of those will die of metastatic breast cancer, spread to other organs outside of the breast and the underarm.
Yeah, if you're not catching it, that's when it spreads, it metastasizes, as you said. Real quick, we have some walks that are coming up.
Yes.
A series of them, yeah.
Yes, we have a series of them. I'm just going to look at my cheat sheet.
Actually, I got some right there.
You got some right there. Well, let's look at
the
that.
expert for you. Yeah.
Yes,
Waterbury, I
we're
believe.
having Waterbury coming up this upcoming weekend, which is the one I'll be attending.
Yeah.
They have one coming up in New London at Rocky Neck State Park.
Yeah.
And they have one in Bridgeport at Seaside Park.
Yeah, so
It's a great way to get out, get a little exercise, enjoy the weather. Hopefully the warmth will, stay with us.
hopefully.
I hear it's going to be about 80 on Tuesday.
That's what we're thinking. Yeah, there might be some rain coming through, but if you can get even into the 70s in October, you can't ask for anything better than that.
Yeah.
Thank you so much for coming in and taking the time to share your story with us.
Oh, thank you so much for having me.
We appreciate it.
Just remember, men can get breast cancer too.
Yep, we still have the breast tissue, the ducts especially, right? You said
Yes,
duct
yes.
carcinoma,
Yeah.
so there you go. All right, well, thank you again.
Thank you.
All right, still to come on Good Day.